Macrolides. Macrolides are bacteriostatic. Indications include these common sites: skin, soft tissue, pulmonary, gastrointestinal, ears, GU, and some STDs. So it covers primarily gram-positive spirochetes. These are spiral-twisted bacterium, including syphilis, Lyme disease, as well as, again, STDs. In addition, it's also used for gonorrhea, chlamydia, H. pylori, which we covered earlier. So H. pylori is a bacterial infection in the digestive tract. At times, macrolides are also used as GI stimulants. So when there's decreased motility and they've tried all the other treatments and they were still unresponsive to those treatments, then they can start using GI stimulants, although this is really not the preferred, right, because it's an antibiotic. Side effects include extreme GI effects, so nausea, vomiting, diarrhea, and it can also cause antibiotic-associated colitis, which is basically inflammation of the lining of the colon secondary to antibiotics. Some precautions: so it has many drug interactions, it can cause cardiac dysrhythmias, and it can prolong QT interval. Now, we also have to be very careful when we're using certain drugs, especially the ones that compete with the CYP450 enzyme, so the ones that are protein bound, because it can cause a delay in the metabolic clearance of one or more interacting drugs, therefore prolonging its clearance and possibly causing toxic effects. Contraindications: so concurrent use with some antihistamines and antifungal agents. That's why it's very important to assess for possible drug interaction, and it's very important to get a very thorough medication history of the patient. Nursing actions include ensuring reason for use, because it can be used as an antimicrobial agent or antibiotic, and at times it can be used as a GI stimulant. Now, patient education. It is very important to educate our patient when it comes to the GI effects, depending on what class. Examples of drugs in this class include fidaxomicin, erythromycin. So erythromycin is sometimes ordered specifically due to diarrhea side effect, and as well as azithromycin. So sometimes it's also used as a GI stimulant, but it is most commonly prescribed as a treatment for respiratory infections. Fluoroquinolones. Fluoroquinolones are very potent bactericidal antibiotics. So these antibiotics are broad spectrum. They primarily cover gram-negative organisms, but they also have an effect on gram-positive organisms. This is most commonly used for UTI, prostatitis, anthrax, sinusitis, bronchitis, community-acquired pneumonia, acute otitis externa in a form of drops, as well as ocular infections. Some side effects include cardiac dysrhythmias and QT prolongation, just like the other one. Now, some other side effects include nausea, constipation, and photosensitivity. So this has a black box warning, which is tendonitis or tendon rupture. So if a patient develops a tendon rupture and they're on fluoroquinolones, the most likely cause of it is the fluoroquinolones. Some precautions include cardiac dysrhythmias, renal disease, seizure disorder. Now, contraindications include concurrent use of a class 1A and class 3 antidysrhythmic agents because of the increased risk of dangerous arrhythmias. Also, use in children oral route, it may affect the development of their cartilage. So if we can have an alternative antibiotic to give, that is more preferred for children rather than administering fluoroquinolones, unless obviously there's nothing else that we can give to these children. Nursing actions include renal function, so we need to analyze, monitor, so follow our renal functions. Also, we need to keep an eye on our cardiac rhythm, especially if we have a patient on the telemetry unit. Now, also a very thorough assessment and basically making sure that they don't develop the side effect of tendonitis or tendon rupture by properly assessing for muscle and tendon pain or any other symptoms that may be associated with that. Now, examples of drugs in this class include ciprofloxacin and levofloxacin.